as a patient, so as regards your healthcare, are you a lion or are you a lamb? So lamb obviously is very, very docile and just is led wherever, does whatever they're told. Lions are more aggressive, more in your face, asking more questions. And I'm not talking about being belligerent with your clinician, but the bottom line is this: we are in a healthcare model at the moment, and we've been for quite some time, which is very pharmaceutically driven, very siloed. And what's meant by that is that you've experienced this, is that your body is put into different categories depending on what's bothering you. So if you have a headache, your brain is going to get checked out. And if you have a stomach ache, your gastrointestinal tract is going to be checked out. And if you have heart palpitations, your heart's going to be checked out. Now, there's nothing wrong with it being checked out, but what can happen and what's missed is that each symptom is treated individually rather than saying, how is this all coming together? Now, what I do, what my team does, is root cause medicine. And by the very name, you know what that means, which is, okay, so we've got symptom 1, 2, 3, 4, 5. What do they have in common? How did we get here? So it's standing back and looking at your body as a whole and saying, how did this all come together? Realizing that it's not just 5 individual problems. It could be 1 or 2 key root cause issues that have gotten us there. But if you don't think about the body and how it interrelates and how it intercommunicates, you're going to miss that. And the reason I'm making this video is that I want you to know that is how the body works. It knows how to heal itself. It's very strong. It's an incredibly strong machine. I do call bodies machines. And when it's appreciated that it knows how to heal, and really our job as clinicians is to say, what's burdening you, body? What are these burdens, and how do I identify and remove them, and keep identifying and removing them so you, body, can heal, because you know how to heal. I'm just obstacle removing, I'm identifying and removing obstacles. That's how we think about it, and it works beautifully. Now, what happens if you're a lamb is you go to the doctor and he says, okay, you have acid reflux, here's your antacid. Okay, thank you. Oh, by the way, I also have heart palpitations. Oh, okay, we're going to refer you to a cardiologist. Okay, so you go to the cardiologist, and they're like, there's nothing really wrong with your heart. You don't have heart disease, but I understand you have these heart palpitations, so here's a drug to slow down your heart. Okay. Oh, by the way, I have shortness of breath. Okay, so we'll send you to a pulmonologist, a lung specialist. Okay, so you go there and they go, your lungs are fine. There's really nothing wrong with your lungs at all. But we can give you an asthma medication to open up your bronchioles, so that might help you breathe easier. Okay, and that's the way you go along in life. You're not asking, hey, do these antacids have side effects? Do any long-term side effects? Like dementia and losing bone density and getting infections, just to name 3 out of at least 10. Is there another reason why I might have this? By the way, is it all related? Because I realize when my acid reflux is worse, my heart palpitations are worse. So it seems related. But the cardiologist says, no, that's not possible. You go, oh, okay, but this is a lion talking, right? The lion would go, yeah, but I've noticed that. Like, it's my body, by the way, and I've noticed that. So, when patients, for us, give these correlations, we love it. We jump on that. It's like, yeah, you know this machine better than anybody. You're living in it. So we want to hear all these nuances, everything you've noticed, because that's how we go after figuring out root cause. Now, we use a lot of sophisticated lab tests that give us information, but we're seeing that connection. And that's what you deserve. You deserve to not be just given drug, and be told, well, oh, it's not, you're getting older. I love that excuse. Well, you're getting older, this happens. Well, why do I have this autoimmune disease? We don't know. It just happens. That doesn't make any sense. It should make sense. Our patients say that all the time, It's like, well, that really makes sense. I'm like, it should. It should make sense. And the treatment makes sense too. So stop being a lamb. start being a lion, realizing you have every right. This is your body. You only have one. You have every right to demand that someone figures it out, that they figure out what's the connection between all your symptoms, because there is one. And you deserve to be treated that way. Now, I know we can run into the problem of, but my insurance only covers doctors who think the other way. I understand. It's a problem, but again, you've only got one body. So making a commitment, making a financial commitment to clinicians who think this way, what is that worth? Okay. Granted, insurance is likely not going to cover, but what is it worth to regain your health? For some of us, it's everything. And feeling the way you're feeling and continue feeling that way and knowing you're on drugs with dangerous side effects, that's just not worth it. It's not worth any cost. So I want you to be more of a lion. And if you are looking for that kind of clinician, we treat patients all over the country, so we're here for you. If you're not a good fit for us, we'll help you find someone who is a good fit. But yeah, reach out to us for a consultation and we'd be delighted to help.